podcast is sponsored by SynergyRx, a healthcare technology company using pharmacist-led clinical services to improve medication adherence and patient outcomes. SynergyRx works alongside physicians and other healthcare professionals to deliver coordinated, high-quality care. Today, we are talking to the amazing Amina Abubakar, and she is going to share her wisdom with us today, and we are so excited that she is here. Amina is the CEO of Avant Pharmacy and Wellness Center, the CEO of Roho Voyage, and Director of Value-Based Contracting at Livia Health. So, Amina, we're so glad that you're here today. Thank you so much for coming on with us.
My pleasure. I think I shared with Lindsay is that while I do many things, they're all threaded in the same values and concept. So they show up as a different project, a different program, but underneath it, it's kind of a very similar mindset, no matter what it is that I'm tackling. And so I think maybe, that could be like maybe the foundation, because these things I always say is the tip of the iceberg.
Okay. Where did that start? How did that start for you where you were like, this is the problem and I know I'm the one that can fix it?
Sure. I think one of the privilege I have is having context to two different worlds. So I see things in different dimensions, right? And then I'm able to ask myself, how did this group get here? And how did this group get here? Right?
Are the two worlds like the doctor's world and the pharmacist world?
I'll tell you just in general. So I grew up in Africa, okay? And with Africa, it's a very different concept. No one likes to do anything alone, okay? It doesn't matter what it is. Everyone wants a companion, a friend, so everything is about together. So if someone is going to do a project, they will reach out to a few people and want them to be part of it. So that is kind of the culture I grew up with. Everything, it was always collaborative. What would benefit your community? What would benefit your family? So it wasn't an individual journey. So that's kind of like the background, Very similar to, I don't know if you guys know my story when I decided I wanted to come to America. Of course, my parents were like, oh, that's a great idea, Amina, but we don't have money. How are you going to go to America? So the first place I knew to go to was to all my friends in high school. And I said, guys, I want to go to America and I need your help. Right. And so that's kind of, it's a good thing that you can be comfortable to reach out and ask for help when you think that you can't do it by yourself. And so my friends were like, so how do we help you? Like, we can't get you to America. I said, well, the difference between me being able to get there is financial. And I have an idea, but I can't pull it out by myself. So I want to raise money. And how you guys can help me is part of the fundraising. And so we will put together a talent show because I knew several friends that were either in dance clubs or they had just different talents. And I said, we can put together a show that we could sell tickets to the rest of the high schools, the communities, and that's how I'll raise money. And they were like, oh, that's feasible. So kind of like broken out the big problem into like, okay, it's financial. Well, then how do I get the money? Then I need to do something that can generate money. And then who will do it with me were my friends. So we did that and I raised a lot of money and then I was able to come. So it's kind of, those are the things that I knew when you can't succeed by yourself or when you don't know how to do something, alone isn't the lane to be on. It's to find others who can support you. So then the difference then when I got to the US and I started to understand why people were very successful in the US, it was an individual pride. I did it. It was me. I can do this. And it's not right or wrong, but I feel like today things have changed, right? It may have been that was the driving force for success when you can do things by yourself. We are proud. And that took us to a point. Now I look at where we're stuck as a profession. I look at, okay, that was successful. tons of independent pharmacies were born, they were super thriving and successful because they had that grit, they had that hard work, they were accountable, and they didn't wait for anyone to help them. They figured it out. Okay, but it only could get us here. Now I look at the distance we need to travel because we're not getting the results we want. We're actually shrinking as independent pharmacy owners. So what got us here isn't going to get us there. So then I look at my other side and said, this is the time not to be alone. Okay? This is the time to go with others. So I start looking at what is the challenge that is facing these individuals by being alone, right? And then I studied that and I was like, yes, they need to collaborate because I can see their strength and I can see what they could do more if they amplified their organizations. And then I started looking at, I said, I'm curious if independent doctors feel the same way as independent pharmacists, because these are both healthcare professionals. They're the first line. They're the ones who actually touch a patient and know firsthand the barriers, what the patients are trying to solve. Yet, if they're frustrated and they're feeling dissatisfied, maybe their strength is together. Because one is saying, we do so much, but no one is paying us. But we love doing it, and we would love to help our community. We would love to help our patients, but we can no longer do it. The margins are too thin to give. Before, the margins were sufficient, where when you helped people, you felt like you were giving back from the margins. But now, no margin, no mission, right? It's impossible. Then I listened to these guys. We're overwhelmed. In order for us to get money, more money, we have to do more. But what they define as more is exactly what these guys are already doing.
Yeah.
So why don't they come together, help each other, and see how each other win and the patients win? So that's how I think about, I dissect the problems and said, is this an individual effort or is this a collaborative effort?
That's one. And then but you have the ability and the wherewithal to be able to get people to listen. That's the hardest part, right? You see the answer and you're able to go and talk to these physicians and groups and get them to listen and then act, which sounds easy, but it is very hard to get people to change their track where they are like, no, this is the way it's always been done.
Yeah.
And bring
How
in
do you
like
introduce
the
that?
cross culture of it all.
I think it's because many people go into these conversations to tell them what they need to do versus to really understand what it is they want. Okay? And physicians are being sold something every single day. No rep brings a free lunch because they just care to thank the provider, right? No organization just visits them just because. So they have fatigue on sales. A lot of physicians are very emotional when it comes to patient care. So I think most conversations are normally derived from a marketing strategy for what I can offer you, what I'm good at, what I can do, versus the humility part of is like, I want to know more about your world.
See you.
Yes, and I would like to know what's in the way of your joy, of your success. What is your frustrations before I even give them a solution? Because I'm curious as to what it is that I could help them with. Because I can't just say, I'll come in and do your CCM, RPM. That's just a code. That doesn't solve anything for them, right? Because revenue may not be the only stressor that's keeping them up at night. They have staff issues. They have They're trying to figure out life. They also have families. They're navigating, divorces. They're not navigating kids. It's kind of like the human part, I feel like, is what was lacking for many people because we're not comfortable to have these human connections, right? It's more about a transactional connection. I'm a pharmacist, you're a doctor. Let's get together. Let's do this. Here's the revenue. Well, for me, because two of my biggest values are positive energy and connection, I like to connect with people that I want to work with. So I like to know more about them. I want to know more about why they even opened a practice. So I feel like it's a relationship business versus a transactional business. So that's why for me, it was easier for them to say the truth. Oh, I don't want to work for the health systems. I've done that. I want to have my freedom. I want to be able to do what I want. So what is your frustration then if you have this, you have it? Oh, well, here's where I struggle. And then I'm able to connect my services to that solution. I learned a long time ago, people don't buy products. People buy solutions. So if you can't help them see a problem, then you don't have anything to sell to them.
Yeah. Wow.
I like that
That
kind of
is,
build the relationship and then maybe have the transaction once we
Correct, because
define that relationship.
I'm not saying transactions don't win. They can, but they don't go far. The second someone else can cut that transaction in half, they're going to move because there's no collaboration into we're solving multifaceted problems. We're solving to be in our community. We're solving to be independent because what's happening to me is going to happen to you. We let the big chains go unchecked for so long. They got away with it, right? And look at where we are now. So I'm happy to show you the crystal ball on where your future is headed if you do nothing today, right? But also something else with time, I become smarter, not because I know more, but I can see things unfolding now and I can connect those dots.
that's called wisdom. You've got it.
Right. So now maybe I can help people articulate better than when I was articulating it. Because again, I didn't have the road paved. So I was just being human. I was vulnerable. I needed their help, just like I needed help from my friends. I needed help from these guys, Could they help me? Because a new prescription to me was hurting me sometimes. They didn't even know that. They were like, really? Yes. Can I show you? Here's a printout of my DIR fees. That's illegal. Oh, welcome to my world of where I
Yes.
live in. So I was able to welcome them to see the problems that exist and we have to solve them, right? The good news is the bigger organizations are making it easier for us now because if you look at their vertical integration, you can call it vertical integration. I call it collaboration. Whether they acquire, whether they are, working together, they have some alignment. It may not work in our favor. It's hurting us. But they figured like CVS Caremark, they couldn't be alone, right? They needed to own a pharmacy. Oh, the pharmacy, we need to own the PBM. Okay, we got to own the medical. We got to buy Aetna. We got to buy this. Well, I'm saying that is not the best model, but they're saying that these things have to be aligned. So imagine if we thought about the same integration, but there's no common ownership. It's individuals that are here is the independent pharmacies. Here are the independent doctors. Here are the independent PBMs. They're all owned separately, but we have a mutual way to collaborate. So that way we can achieve the same things that these guys say they can achieve, right? But it's not a monopoly anymore. It's a thriving community. Like I don't have to be the case manager. I need the best case managers in my community. I don't need to own the home health, but I need to identify the home health individuals in my community that we have aligned values to take care of our patients. But CVS showed us they bought home health, they bought medical, they bought insurance, they have pharmacies. So to me, they've shown you the playbook, but we don't have to destroy the market and economy by monopolizing. We just need to collaborate. That's how I see it.
This is why Amina is going to run for president in 2020.
Yes.
I will write it in. I just like, wow. I feel like you
But you see the
have,
concept, you see the problem, you go backwards and you say, how did we get here? Okay. And then you go there. Like it's always the genesis of identity. There's a reason we got here. And sometimes that reason was for a season. Okay. But how do we get to the next? Then we follow that.
did
And
you ever,
luckily,
did you like that path wasn't clear for you though? Or
of
that
course,
you know, obviously like, well, unless you were extremely lucky and, it probably didn't happen the first time you went and talked to a doctor or a practice, but like what,
it actually
how did
did.
you
And
learn to
this is what I'm
trust
saying, because
yourself?
correct, this is what I'm saying. I have to say, there are three things that help me in
Did you say
life.
it did? It did happen the first time you went and talked to a
Correct.
doctor?
But there are three
I
things
love
that
it.
help me in life: God, Google, and grace. Okay. Those are the three things that to me have always
Love
kind
it.
of helped me. I started Google. Okay. And then I see ideas or thoughts. Then I pray to God that this works because I'm looking for answers. Right. And then grace is just failing and figuring out and saying, it's okay to fail, but I'm now really committed to this concept. I don't have the pathway, but I could see that this is the right way to go. And I can keep failing and I can keep flipping.
Giving yourself grace.
Correct.
Yeah.
You know,
Okay.
that it's okay because my alternative isn't comfortable either. Right? My uncomfortable situation isn't comfortable either. So I'll walk you through an example, and that would kind of put it together. So as I opened the pharmacy, 4 years into it, I just thought this is not for me anymore. It's just harder and harder. And the concepts seem easy, but the math seems complex that a calculator could never really tell me what my profit could be because cost of goods would change and they change based on a brand. And then
DIR.
I couldn't control what patients are coming to my pharmacy when I ended up serving a huge population of HIV patients. And then I was being penalized because I was high in brand. Well, I wasn't looking at brand and generic. I'm looking at patients. This happened to be the population that I'm working with, but you're telling me this is penalizing me. So do I get rid of these patients? There's no generic equivalent for these HIV meds back in the days. So I was stuck in a system that I felt like it can't help me break out of this. So I said to myself, well, I didn't go to school for this. You know, the reason why I loved serving these patients, they were complex. There were tons of drug interactions. They were being seen by primary care, and I would fill prescriptions and say, hey, you got this patient on a boosted agent, but they also have this other drug on file. And I realized these doctors really didn't know what to do with all these multiple drug interactions, right? And then I saw patients that were embarrassed. I saw patients that felt judged and felt what they did to get HIV was judged. And you really don't know. Some of them, it was an infidelity partner. Some of them were raped. Some of them were born with. So there was more to this diagnosis that I felt these patients weren't getting the care because they already felt dirty. They already felt they did something wrong or immoral, right? And so I loved counseling them and taking the stigma out and working through viral suppression is all I care about. And this is how we're going to get viral suppression. Before we even had the term viral suppression, like the new negative is like viral suppression is the new negative, right? Because you can then have babies without transmission, you can have a partner. So I'm like, there's hope, but how do I get this individual to see the hope when all they feel is this, right? But then my wholesaler is like, oh, you're not making money because you're taking care of like a whole bunch of brand medication. So there was a disconnect in how I could serve this population. But I knew the challenges that existed. So I was always curious, could I just quit the pharmacy and go be a clinical pharmacist in an HIV clinic and help these patients? Because that's all I wanted to really do. But those jobs, you needed to have a specialty, whatever. You needed to have done these multiple residencies. So access for me to get that role wasn't possible either. So do I give up or do I try to figure a way? So my curiosity was to go to this doctor who sees these patients and says, I know you could use my help. We need to move from you text messaging me and me doing tons of research to help your patients. I need to figure out how you can afford to have me help you further than these prescriptions. So I went on Google and I was looking for how can pharmacists get paid to do clinical work, just trying to get ideas that are not in the traditional method. Then I saw an article by UNC. And I read this article and it said, pharmacists paying their way through annual wellness visits. And they did an amazing case and they showed how the providers were so satisfied. The pharmacists would meet with the patient. They would do an annual wellness visit. And then there was a code that was able to be billed by the physicians. And then that's how they were able to retain all these ambulatory care pharmacists. So they were paying their way through this clinical world. And I was like, what is AWV? Google again. And so it kind of lends me to like a Medicare Learning Network and it tells me what the code is. And I started to figure it out. And I was like, you know what? So I took a screenshot and we have it. Me and Olivia was one of our first pharmacists. And I sent it to Olivia on a Facebook Messenger. And I said, I don't know what this is, but this might be our answer. Okay. I said, I'm going to go talk to a doctor to see if they also have this code. Do they know about it? And maybe this is how this doctor could pay us. That's how I started. And so Olivia was like, great, I'll just look more into it and I'll tell you. So the next morning I go to work and I said, I'm now so eager and so curious because this article told me a few things. It told me pharmacists can do it. Okay. It told me physicians found great value. It showed me there's a payment. Well, the only difference, those pharmacists were hired into this health system. My barrier now is like, is it legal for this doctor to pay me if he doesn't hire me? So you get what I'm saying? So I'm following the problem and the solution. It's like, okay, so now the barrier between me doing this, I figured out legally I can do it. Pharmacists can. Scope is not an issue. Payment is. So I was like, I'm curious. Let me go to this doctor's office. So that was the first doctor I went to. And I said, hey, doc, I'm curious. Have you ever heard of this code called annual wellness visit? He's like, no, probably, but do you use it? He was like, no. I was like, well, I found a way, and here's an article all printed. If you can read it, it says that it pays this amount of money. It was significant. And I was said, that means I could see those patients and counsel and do all this work that we've been doing, and you can bill this, and then you can pay us from there. So nothing is really going to be coming out of pocket. He was like, okay, so what do I do next? I said, well, I'll be back because I need to talk to a healthcare lawyer to make sure this is legal part of payment. I said, that's the only thing that's missing. I want to make sure that it's not going to be considered a problem. So I got a healthcare attorney, and he looked at it and he said, absolutely, because he can contract you. He's allowed to hire or contract for a service that is billed under them. This happens, they can hire nutritionists, they can hire physical therapists, they can hire other specialists that they contract under their NPI, and they bill for their work and just pay them.
Hmm.
I was like, wow, maybe this is our answer. So I went back. I said, it's possible, but let me go one more place. Let me go to the board of pharmacy again. I don't want to get him in trouble, and I don't want to get in trouble. And so the board of pharmacy is like, we don't know what you're doing. We don't understand. And I was like, what?
Yeah.
Okay. So then I said, maybe it's not the board of pharmacy, it's the medical board, right? So I went to, but anyway, to make the long story short, through Google research, I found out that it was perfect as long as we had an agreement and it was stated clearly what my scope was, and I wasn't going above my scope. So I wasn't diagnosing, I wasn't prescribing. I was really doing an extended MTM because we review the meds, we look at the risk factors, we counsel, we put a preventative plan together. So there was nothing that I couldn't do within my scope. And that's how our first code really happened. And we did it. He billed it. We got the EOB. He got paid, and we were just couldn't believe it. And that was just the beginning of what Avant became. It became that doctor and the next doctor and the next code. And I'm very excited every time I see Medicare expanding collaborative codes. So to answer you, Katie, it wasn't marketing. It wasn't that I knew. It wasn't a clear pathway. It was pieces of the puzzle that I had to put together. But now over time, I can package that and I can explain to people maybe how they would sell it today, because I was lucky that that doctor, he needed me anyway, right? But now how do you scale? How do you go beyond that? So that, I hope that kind of shows you how it all started.
I love
It's
the lore.
just, yeah,
Started with a Facebook message.
honestly. And then do your parents know how much you've changed, like, our whole healthcare sector here in America? Do they understand? Are they here?
No, they're not. But my mom
Do
just
you
recently
understand how
said,
much you've changed our healthcare world?
no, again, for me, it's one problem at a time. And I think I never stepped back to look at like how everything morphed. It's just like I was telling someone, I don't think retirement is in my DNA because I like waking up and what's the problem of the day?
What would
You
we do
know?
if you retired? I
You
don't know
know,
what we
what's
would
the
do.
problem of the day?
No.
And we do it. But my mom recently made a comment. So on the side, I started booking these African safaris and added destination
Yes.
CE and do all these things. And so I was home and I was telling my mom, you know what? Because she heard me on the calls and I was like, so this is like a real thing for you? I was like, yes. And she was like, it's like everything else. You just start, you really don't know what you're doing in the beginning. And then, because I was telling her how much I've learned and how much I've connected to like different organization, like the AMA was like, this is genius. I think we should get more physicians with burnout to travel
Yes.
and do this. So I was just telling my mom after that call, and she said, oh, Amina, I remember when you opened the pharmacy. Didn't you know what you were doing either? It's the same thing. So to tell you, it's like, they just know I'm okay getting into something that I don't have all the answers, as long as I know why this may be important, how it can help me, it can help those individuals that I want to work with, how it helps others, and that it's legal. If I can get clearance on these things, then I will work tirelessly to make the logistics work and finally get the financials there.
Well, it's really fantastic. And you've teased it up a little bit, but what does the next 10 years look like for our profession? What are you working on? What do you see coming down the road? You can tease it up a little bit for everybody.
So, in the next 10 years, pharmacists have to figure out the value of selling their expertise in value-based contracts. Okay. Uh, it'll be hard for the US to go back and say it's a fee for service, that you get paid even if patients aren't improving, when so much data shows that when you pay for value, you actually get better results. The workload on a value-based contract in any medical practice, accountable care organization, you name it, it is so difficult because those care gaps are patients. They're not just a list, okay? If you're going to see care gaps as just like check boxes, as healthcare professionals, you're not going to survive. But if you look at them, because I look at a list of care gaps and I say, okay, we have a huge vaccine care gap. We have to work on vaccine hesitancy. So there's work in order for us to close that gap. Counseling has to work, trust has to be rebuilt. We have to do something about it. But in a quality metric, it just looks like, oh, you're not closing the gaps of vaccinations. Okay, in order for us to do vaccine hesitancy and get an immunizer and get someone who can probably talk to the patients, be in the community, patients trust, has the same accent, lives there, knows them. It's different now when I think, oh, Lindsay's asking me. I trust her. She's grown up in this community. She's not going to stray me. Okay, I may be open to listen to now. Lindsay's an influencer for that, right? So I look at that. I look at missed appointments. What are the barriers that these patients have? Is it transportation? Is it this? I look at, like, one clinic said, we lost so much money from adherence rates, and adherence was triple weighted. Knowing this kind of language, adherence is triple rated. These pharmacists are doing packaging and delivering. They are removing the barrier to this measure, and it's triple weighted for you. Well, I think you should be able to contract and have this pharmacist, you name it, as a profession. It's not just the independent pharmacy world. I see hope. I see opportunities where pharmacists are coming out. They don't have to go to a brick and mortar. It's opening up more jobs. It's opening up more opportunities, whether virtual, whether in person, whether strategically, under quality, under care gap closure, under all these revenue cycles of value-based contracts, where I feel like pharmacists are the answer. So yes, that's where I see that finally we can get the cognitive work done. We don't have to wait for the legislation to change. We have colleagues that are in trouble if they don't meet these metrics, but also they have missed opportunities if they don't. So who's winning if they can't solve it? We're not winning, they're not winning. And so that's why I say, so the future is definitely collaborative care and the conversation of being comfortable about getting paid for it without legislature changes.
Yeah. Is there a way we can scale something like that? Are there vehicles available for us to be able to scale the services through value-based contracts?
Yes, I feel like CPSN is one because it's a clinically integrated network. I know people say, oh, I don't know what CPSN is doing and all those things, but mostly they're volunteers who are doing this, waking up in the morning, trying to figure out. But if you think about infrastructure through CPSN, when you have a group that would speak on behalf of everyone and be able to go to a payer or be able to go to an accountable care organization and say, we have X number of pharmacies, we have them in these rural communities, we have some that specialize in ABC. So I feel like coming together as a provider network and they can be plugged in. It doesn't mean every pharmacy has to do this everything. Pharmacists could have a profile and say, we are able to do this, this, and this, and start saying we have a general primary care pharmacy network. We have X number of specialists that do HIV, that do genetic testing, that do, diabetes, that do pediatrics, right? So I see that to me as how you scale it. We have to look uniform. We don't have to be owned together, like by one person, but we have to come under an accountable organization that allows a single signature, that allows easy training and deployment, but keep the individuals individually owned. That's how I see is the way out. there is more hope because everything coming out of this administration right now when it comes to healthcare, everything that I see there, collaboration is a key. So it's not us asking anymore. It's they're being told they need to collaborate. How I got into that whole dementia care model, it's called GUIDE. It's a reimagined dementia care experience. And they were looking for innovative practices that are willing to manage dementia in the community. Your application had to show collaboration with community partners. Okay? To apply, you had to be a medical provider. But to execute, you needed collaboration. And I thought, wow, these were words from Medicare. So we applied and we used CPSN network pharmacies as our collaborators. And we got it. It's an 8-year contract. Okay? Because they were like, if we know you're a medical provider, you're going to need other people to keep the patients with dementia in the home versus a facility. And we would rather pay you guys our per member per month to coordinate. So it's not clinical. All it is navigation. So they wanted us to generate or create dementia care navigators in the community. And my background in HIV care, that's why HIV was very successful in us getting viral loads down and getting access to care because they were HIV case managers. When a patient got diagnosed, they went to an HIV case manager who made sure they had everything they needed, right? It's the same thing. I'm seeing it in dementia care. Medicare envisions when a diagnosis is met, these patients are referred to organizations that are part of GUIDE because GUIDE has resources for family, caregivers, and the patient. And I'm like, wow, what can we do next if I look at HIV model? Well, the case managers then started getting funded for early screening. So they would go out in the communities and do HIV screening. And I'm thinking, we can do the same thing with navigation, getting in the community and do early screening for cognitive decline, because by the time the patients get the diagnosis, it's a little too late.
Mm-hmm.
You see, so evolution is happening and pharmacists just need to be ready, open in how we're going to practice. I've said this many times, pharmacy will exist 100 years from today. It will look different and we are responsible to shaping how we want it to look because we can be part of the feedback, the transformations, the innovations, and showing real examples how things can be done.
I think what's so interesting is that you talk about it from like an independent pharmacy side of thought, but I feel like it can also be applied to an individual pharmacist
Absolutely. That I
or
said.
a healthcare facility, like a hospital system can also jump in and be like, we can also provide these services through our healthcare system. And
they
I
are.
think it navigates all formulations of pharmacists out there. It doesn't have to be just the independent world. We just happen to come from the independent world and that's what we know. But I think like for our listeners who are not in that world, like you can also do this. You could do this as your
It could
own
be a
person
consultant
or
pharmacist
yes.
inserting themselves in a health system,
I
in a
think
primary
that's
care office. Yes. And that's kind of, you probably
it's
kind of
exciting.
missed that. To me, it is the profession. The profession is finally able to express its value, but also getting a payment model without changing legislation. I know we can keep fighting for that, and hopefully one day it will come. But in the meantime, there are vehicles that exist. And so why not do that now?
That's an interesting point, Katie. I think the health systems already have similar processes in place. The people that I see that need the most help right now are independent physicians. I have some communication online, and independent physicians are under the same amount of pressure that independent pharmacy is under. And so they're trying to navigate a system that really the vertical integration is crushing them as well. So I think that's where the initial partnership for most people who are either a consultant or an independent practitioner wants to reach out to independent physicians. I don't know if you agree with that, Amina.
Yes, and so every year we have the Avant Symposium, and it's my favorite thing because we actually have nurse practitioners, PAs, physicians, not just pharmacists, and most questions really that are profound come from those providers saying, "How come I didn't know I could work with these individuals? I was afraid. I thought it was Stark law," and so it's such a like an environment of saying, let's have real conversations how you guys can work together. So this past last week we had one, and this physician left there and he's going to visit 2 pharmacies in South Carolina because he's been trying to grow in the South Carolina market and he wants to work with them. One, she has a space that he could go in. It's rural. They need providers. It's all the big health systems. And now she texts me, like, he's coming to visit me. And then, like some have come out there working together. So I feel like it's a new match.com of like
That's
in matching. And I'm
fantastic.
so happy to facilitate that dialogue. So because I can do it at the symposium, I'm able to answer the questions on behalf of the pharmacists, and I'm able to convince the providers in a bigger scale because they're asking what others are also going to ask. So, so that's why we call it the business of collaboration. We all know we can collaborate, but how do the economics work? How do I get physicians comfortable to release those codes in order to get their value-based incentives? But use the code today as a currency to afford these individuals to do the work. Because if you get your triple measures met, if you get your gap closures, some of them didn't even understand their contracts, how much money they were leaving on the table, that they shouldn't be worried about a CCM code of $60. They should be really concerned about them losing millions.
Wow.
Well, um I just had this wonderful, warm, excited feeling in my stomach just listening to you, Amina. So thank you for sharing all of your wisdom as always. And I think that's something that you have always done is shared it with everyone. And so I really appreciate that. I've signed up for some courses through Avant. And I will say, and bring it back to women in pharmacy, but I know this is kind of in general, but what is something that as a woman in pharmacy, what advice could you give for someone who's feeling stuck or unseen or unsure of the next step?
Sure. I think the first thing I would say is to really recalibrate your why, because the how and the what are going to show up. And talking to a lot of women friends that are in the profession, they are balancing being a mother and a wife, and they feel like they're failing at all when they're kind of like trying to get career. Well, we are in today's world where you could be a flex pharmacist, you know, and you could work around your time, around your availability, around your flexibility. If you're able to be part of these value-based organizations, you don't have to physically be there. I know pharmacists that are working, we have several pharmacists that are working from home, and all they do is they enter all these dashboards, they pull the care gaps, they create the clinical notes, they reach out to patients. So I feel like it's an exciting time actually for a woman pharmacist, where the career is opening up opportunities that we didn't have them before, where you could work and have your kids home, and you have your deliverables that are outcome based, right? Your goal is to get A1Cs down, and you're reviewing medications, optimizing the therapy, sending them messages through the portal to the providers. This patient needs to be increased dose by X. This patient needs to be switched to drug A to B. So I actually think to look at what are they looking for. But I also know pharmacists that they don't like a virtual job. I love to see people. So if I if I do a virtual work, it can only take me for so long. And then I'm like, I need humans. I need to get
Same.
there, you know? So again, but the opportunities are available for them. You don't have to wait for a health system. You can approach independent docs in your area. You have a case to show them they can afford you. These just using Medicare codes, that you could do it for them and they could pay your salary. And if they do that, you can show them what the return would be. So I think it's actually exciting to be able to do clinical work, cognitive work that helps patients, helps the health systems, helps the providers, and make you feel good. So more choices.
Fantastic.
You have all this energy for the next best thing. How do you protect that when our profession is constantly asking for more from us?
Great question. It's asking more from us because they know we can do it. But we need to learn to let go of things that no longer serve us. Okay. So there are things on our plate that we should learn to let go. So we shouldn't be afraid of pharmacy technician scopes being expanded because they can take more. So yes, I want to do more, but I want to help my team understand things that they're doing today that do not require their license. They just know because they were used to doing it. It's how we did it before, and we need to let go of that. Okay. So then suddenly you're not doing more. You're doing what your license requires, and you're letting go of things that you don't need to do.
You're working at the top
AI
of
is
your
coming.
license.
Data
Mhm.
entry is being done by AI. The world has changed, and we need to open our eyes and utilize the tools, the resources that we have, and make space for what matters.
Wow.
That makes so much sense. And it's really tough to do. I mean, just thinking about this week in the pharmacy of all the things that I've just been like, well, I'll just get that done. I'll get that done versus just it will get
It
done.
takes intention.
You
It's
know,
not easy. It takes intention, and you have to learn to let go because it's not easy, and that discomfort has to be okay. All right. And if it makes you uncomfortable to let go, that means you haven't done enough training for the people that you want to give this to. So sometimes to slow down to go fast. I've had to pause some projects and tell that I know I was at this many miles per hour, but I'm getting comfortable to say, it's okay if we don't get there, guys. We have to halt this. We're going to go slow in order to go fast. That means everything that made you uncomfortable. I have this conversation with my farmers. I was like, well, who's going to do this? And then I'll have to fix it and blah, blah, blah. I said, then we have a problem and we need to address this problem. So we're going to pause on the project. It's okay. And we need to go back and you need to tell me, what would it take for this individual to know what to do? It's going to slow us down. Record yourself. I don't care if you record on your phone and we give it to Chat GPT. They turn it into a step-by-step, review it. We're going to have to do something about it. And now we have more tools to help us. So they're like, okay, that makes sense. So I think also as leaders or in organizations, giving our teams permission, because sometimes we are like pushing them really far, really fast, and they need help to let go.
They do. And I'll say, I love hearing you talk about that. It's okay to pause, to speed back up. It's, slow down to speed back up. I think we all need to hear that. And I just see you as a lifelong learner. I've watched you just innovate and create so many just incredible niches in pharmacy that everybody admires and is watching you know and then you go on a tangent and you create this travel company and CE. So I want to talk about that little bit because that goes along with something that we really want to emphasize for our listeners is not only work hard, be a lifelong learner, innovate, all those things that you represent, but we also talk a lot about wellness and being away, being intentional about stepping away, resting, So talk a little bit about your travel and CE company and all the wonderful things you're doing with that because it's life changing. Everybody who goes on your trips come back and has the most amazing things to say. And so it's on our bucket list. Someone that I love has a very big birthday this year, so we're trying to figure out how we make it fit, but I want you to talk about that and how you share those life-changing experiences with so many people.
Yes. So I watch everyone around me give so much of themselves, especially business owners. A lot of people don't realize that it is not that glamorous sometimes. It's uncertainty, it's discomfort. They live with so much uncertainty constant. There's like that cortisol level that doesn't go down even when we want it to come down, right? It's just you're worried about your family, you're worried about your business, your staff, payroll, and then the industry is changing so fast. And that dissatisfaction was increasing, like, and which wanted to protect the profession because we need everyone still in the game, in the race, in order to make this innovation work. And I thought to myself, where could I take some of these individuals and truly feel taken care of for once? It's about them, that no one else, they don't have to worry about anyone, they don't have to worry about anything. And that's kind of like a gift for themselves to let go and just kind of feel that way. And I know every time I go home, every time I go back to Kenya, I get so refreshed. I get so many new ideas. I see things differently. And first I thought because I'm going home, and home has that feeling for me. Then along the way, people would come along. Before I had the company, I was always doing trips for people. They say, "Oh, you're from Africa. Well, my parents are celebrating their 50th wedding anniversary. They're celebrating this. They want to go to Africa. Africa's on the bucket list." And I would coordinate and I would let, they would go and they would come back and they would always say all these things. "Oh my God, that was amazing." And I was like, there has to be something here, you know? And maybe I can design something intentionally and force people to get out of their seat and come along. And that's when I was like, okay, so I designed the first safari. And I tell you, people were emotional and we pick places that allow you to really disconnect, but it's so beautiful that it takes your breath away. And the service, like you are the princess, prince, queen, king. It's all about you. From the moment you step in that country, you don't have to worry until we put you back on the plane. And then I was like, okay, but these guys are so busy. If they're going to take the time off, they need to get something else, maybe that would feel them comfortable. How do we add a CE to it? They have to get CEs anywhere. Now they're like getting a bucket list trip done. They're getting their CE taken care of and they're feeling good and inspired. And that's how it all came together. And then it became very popular, where now they're taking me outside of my comfort zone. People's like, okay, we've done Kenya with you. We've done Egypt with you. Where are you taking us next? I'm like, well, there was not a next. I just love Africa. They're like, no, I think. And then they make friends. And it's just kind of like taking adults to a summer camp, where they're like they have new friends and they're having a good time. So I really, really enjoy it. And I feel like Africa naturally has that for people. Many people tell me it feels like homecoming, it feels like clarity, it feels like rest. And not that they don't love the rest of the world, they do, but Africa always presents an emotional response for people. And so that's why I've enjoyed doing it.
It's so fantastic. I can't wait I dream of getting to go one day. And so that's on our bucket list too. So, but
Yeah.
thank you for doing that and sharing that with so many people in our profession. I heard nothing but rave reviews about everybody who's had the opportunity to get to go. So,
Yeah, well, thank you.
That's so cool. Well, Amina, again, I'm big fangirl moment just being able to talk to you so long. But as we're wrapping things up, something that we've done with every guest is we've kind of had this nugget at the end of this Empower HERx moment or movement where we kind of have a challenge for our listeners. So if there's anything that you could challenge our listeners to do in the next 30 days, what would that be?
Be comfortable to hear no's. Go out there for anything you've always wanted to do. If you wanted to go collaborate with that doctor, go. Let them tell you no, because there's a power in no. Okay? There's a power in feeling that humility that I think I'm good, but no one really wants to do this with me. But it teaches you a lot about why they would say no. And sometimes no means not at this time, right? So I feel like if people are more comfortable to hear negative, to hear no, and live through it, they're getting closer to success, because they're not going out there because, oh, they're going to reject me or I'm not going to get this. But you really don't know. Right? So you
Yeah.
don't know what you don't know. And if I go out there, I said, I'm going to ask this person, it's okay if they tell me no. So I challenge you to fall in love with no's, because in a few of those no's, it might teach you something, but also there could be a yes that's hiding and you would never get to it.
I feel like we've heard themes from so many of the self-help books or whatever in this, what we've been talking for an hour, and I feel like it's just drilled down the point of 3 or 4 different books that I've read, and just your wisdom is amazing just to share it with
So
us
for
all.
30 days, things they've always wanted to do, someone they wanted to reach out, a job they wanted to apply, a program just do it.
Just
And
do
it's
it.
okay if they say no. What's the worst that could happen? You're back to the same place that you were.
Yeah, exactly. I sent an email this morning like that, and I was like, you know what? I'm gonna do it. Here we go. Send.
Yep.
Why not?
And I think it's okay for us to say no too. Sometimes an
Yes.
opportunity comes up and just in your gut, you're like, something about this is not right. It's okay to say
Yeah.
no. It's okay to walk away and know that something better is on the horizon.
Yeah.
So I see that in so many different ways, and that's so wise. I love it. I love it.
Yes, thank you. That's a great challenge. Well, gonna wrap it up because you've shared so much of your time with us. Thank you again so much, Amina. If you are interested in the Avant Institute, you can reach out at info@avantinstitute.com. And they share so many resources and so many things just on their site as is. And so it's a great place to check out and see what they've got going on there. And hopefully you like this and you want to follow us, and you can share your story with us, join the conversation, and do that wherever you get your podcast. You can check out our website at empowerherrx.com. That's EMPOWHERX.com. Thanks so much, and we look forward to being here again soon.